In this lesson, we are going to discuss EMAR administrations. To access our CareAssist EMAR from our dashboard, click on the Go to CareAssist link on the Go to CareAssist widget. When getting to the CareAssist landing page, state the location if you want to use an EMAR assignment, and then the care setting you would like to document in. In today's example, I'm utilizing the East Care setting. And I'm going to click on the blue Start button at the bottom right-hand side, and then choosing the resident that I want to document on. Now on this page, we have our resident banner. The resident banner is going to include the resident's photo, resident's demographic information such as last name, first name, age, date of birth, gender, the unit, room, and bed that they are assigned to. We have their primary physician, a link to view their care plan, and a link to view their resident profile. Directly below, we have the resident's advanced directives, as well as any resident banners we may have activated for this chart. In the middle of our resident banner, we have our resident quick view. And the resident quick view gives us access on some certain pieces of information from the resident's chart right here on CareAssist instead of having to navigate back to Matrix Care. The remainder of our resident banner consists of our allergies, diagnoses, our diet, as well as our administration instructions. For the diagnoses and in some cases the allergies, you can see here we have a show all link if all of our diagnoses or allergies do not fit in one line. And that is our resident banner. Over here on our left-hand side, we have our resident list. Starting from the top, we have our flow sheets. Now within EMAR, our flow sheets typically start off at all flow sheets. Users have the option to narrow down the flow sheets that they want, and this is in turn going to affect the orders that they will see. Below the flow sheets, we have our EMAR filters. These filters will give us a quick preview of all of the residents that have medications that are due, any that are late, any stat orders, and any follow-ups. We have our sort options for the resident list below. We can sort them by their last name, by their first name, and by their locations. Directly below the sort options, we have the search resident field. Here we can search for our resident using their last name, their first name, and even their room numbers. You're going to notice the resident list below. Any residents that have a blue tile or have a blue clock sign next to their name has orders that are due right now. Now, some orders do fall within a 2-hour administration window, so 1 hour before and 1 hour after, and some of them are within a time range. Some of them may be within a shift. And if you see a red exclamation mark, that means that they have a late medication, and you may see, or a late order rather, you may see their tile turn red as well. As you can see here with my resident here, Mr. Adams, they have both due tasks as well as late tasks. Certain residents who are not in the building at this time, if they are on a therapeutic leave, you can see here, Miss Daniels, I am not able to click on their tile to document on any of their medications. Same here for Stephanie Ferguson. Going back to my resident here, Mr. Aaron Harrell. If I want to hide my resident list, we can do so by clicking on the Hide Resident List tab. And this is just going to give us our main work page. Now our EMAR is split up into 3 different parts. We have our scheduled now orders. So anything that is due as of right now, as I mentioned before, it could be within the administration windows. The second tab is the scheduled later, so any medications outside of this current window. And then the third is as needed for any of our PRN orders that we may need throughout this patient's care. Here at the top, we have our flow sheets here. We get a quick preview of which flow sheets are currently active. And as we stated below, we have all flow sheets. If you were to change that, for example, if I were to take away treatments, it's going to specify which flow sheets are currently active. Directly below that, we have our red star from MatrixCare. Here in CareAssist, they signify that are tasks that are required at some point within this medication administration. To the right of that, we have a link of a last injection site. These are for all of our staff to know which injection sites have been used recently, so we can appropriately cycle through those sites. Directly below, we have each order. You will see the order itself stated, any administration instructions, the history, the quick administration history for this particular order, and then when this order is due. Scrolling down to a medication, each medication order has an information button next to them. And this is going to give you additional drug information for that medication. To administer our orders, we first need to take care of our tasks that are required. For example, our first order here, monitor urinary output Q shift until fever has resolved. And here it's going to ask us for a temperature. I'm going to enter my vitals. I have two options now. The first one is going to be if I wanted to write this temperature from scratch, I could do so. Or to the right, I can associate the last temperature that was recorded for this resident. Using your clinical judgment, staff should know whether or not they can use the last documented temperature. At this point, I'm going to do 102 degrees Fahrenheit. And then we have our route, which is required. And then we're going to go ahead and save our entry by clicking on the green save button at the bottom right-hand side. You're going to notice that our temperature that we have entered is out of acceptable range for this facility. It's going to give us an opportunity to review our work. And if that is truly the temperature of our resident, we simply say yes. You're going to notice that from that order, that red star disappears, and we are free to prep our order. Now for our orders, we do follow a two-step prep and given process. So once you have prepped an order, you can mark it given. And in this case, since we are just doing a temperature check, we can mark it complete to save our work. For medications, we're going to follow a slightly different workflow. It is not reasonable for us to document one medication at a time. So in this case, we're going to prep all of our medications first and then marking them all as given all at once. So here I have prepped a few medications for us for demonstration. Up above, our task required no longer requires that temperature since we have cleared that order. So now it's going to ask us at some point, blood sugar, units, and site. And for that, that's going to be our Novolog order directly below. Here we have the order, any administration instructions, any special instructions, last time it was given, and then if it was not given, what was the reason? Here we have our sliding scale as stated within the order, and any diagnoses associated to this order. We're going to enter in a blood sugar for this resident, clicking into the enter vitals. saving your work. We're going to click on the green save button at the bottom right-hand side. What you're going to notice is within CareAssist, CareAssist will actually automatically give you the amount of units to give based on the blood sugar that was entered under Edit Vitals. So as you can see here, I entered a blood sugar of 155. Based on our sliding scales, 155 falls under 6 units. And you can see here under Med Notes, 6 units is already documented. We still have to document something here, which is our site, which is why we have one more additional note here. Notice that we will have to rotate our sites. So I just want to check our last injection site. All right, so I can see here there was a right arm. I'm going to go ahead and rotate that site. I'm going to put left upper quad, abdomen. Now you can see it is a free text field. So feel free to utilize any methods to identify the sites that your facility is currently utilizing. Once I have prepped this medication, I'm going to go into my prep button. And this is just a way for me to keep track of the medications I have pulled from my cart. Scrolling down, I have a Levaquin 500 milligram tablet oral order. I'm going to go ahead and prep that, signifying that I have taken it out of the cart. Next, I have a multivitamin. And then the last order I have on this is a Vibramycin. Prepping that. Now at this point, I will go ahead and administer my medication physically to my resident. Always note that when you are administering your medications, never to leave your computers, your laptops, or any piece of hardware exposed. We do have a responsibility to follow our HIPAA guidelines. We want to make sure that we either minimize our window or lock our laptop. And once we have returned from administration, we are going to scroll down. If any of the medications happen to have not been given, we can change any of these entries for any of the orders that we have prepped already. For example, if our resident here, Mr. Aaron, refused their Levaquin, I can still keep it as prep as I have taken it out. However, I can state that it was not given. And whenever we are documenting something is not given, we have to give a not given reason. I can state that this was not given because Mr. Aaron refused it. I'm going to go ahead and click done. It's going to save my work. At this point, I can click complete. And that's going to take that Levaquin off of my page. Now for the rest of the medications that I have here, instead of having to press everything as given, I do have a quick shortcut directly below. I have a all prepped given button. That's going to mark all of my medications that I have prepped. And it will mark them all as given all in one time. And then I'm going to go ahead and click complete to save my work. And we're going to notice that some residents do have a red tile indicating a late administration. Now, late administrations happen fairly often within the facility and is not anything to be afraid of. In this case here, Mr. Fairbanks here has an amoxicillin that was due at 6 p.m. and we have not documented that yet. Any orders that you need to document that it is late, we still follow the same protocols. We still click on prep. We still mark it given. The only difference is that if any administrations are late, we will have to state a late reason. So in this case, I'm going to say that it was administered late. So you will have to state a reason for some of these. Sorry, state a comment for some of these reasons. I can click done and then mark it complete to save your work. You're gonna notice if that is the only late administration on their chart, that red tile disappears, that red exclamation mark disappears. Going back to our resident, Mr. Aaron, I wanted to cover a few of the other tabs as well. We have our scheduled later tab, which is any medications that fall outside of the current administration window. And in this case, we have a temperature check for the 11 to 7 shift. Any of the orders on the scheduled later, we do have the same ability to prep and mark it given as well. However, for scheduled later medications, anytime you click prep and you attempt to give it, you will have to state a reason as to why we are giving it earlier. The last tab is the as needed tab. Looking through our as needed orders. To administer an as needed medication, we follow the same protocols. In this case, this acetaminophen here for mild pain. I'm gonna go ahead and prep this and mark it given. For PRN orders or PRN medications, we will have to state a reason as to why we are giving this PRN medication. In this case, this is for pain. I can click done. And then I can click complete. Since we have given an as needed medications, we will have to follow this up at some point. You will notice here under Mr. Aaron's tile on the resident list, he now has a purple bell signifying a PRN follow-up is due. So when it is time to follow this up, we simply go back to the Scheduled Now tab and then document a follow-up. At this point, we are prompted to do a follow-up result. We have effective, not effective, somewhat effective, and other. If your facility requires you to do a current pain level for the follow-up, you could do so by adding a comment. Clicking on done, save the work, and complete. It falls off of our tasks. And that concludes our e-learning. Thank you for listening.